Well, this morning, there's a new warning going out to parents. The U.S. Surgeon General issuing an advisory saying that parents are stressed, depressed, and lonely. The Surgeon General says there's an epidemic of loneliness and stress in this country, and it is negatively impacting mental and physical health. According to the report, 33% of parents report high stress levels compared to 20% of other adults with no children. Joining me now is board-certified clinical psychologist Dr. Jeff Gardere. Doctor, thank you for joining us this morning. I think people might look at this report and say, yeah, people with kids are going to have more stress than people that don't have kids. Still, what makes these numbers so startling?
Well, it's the bottom line here is Dr. Vivek Murthy, who you refer to, our Surgeon General. This has been very much of a personal information that much of this report is based on, and therefore he's able to connect with parents. Many times we talk about the joy of parenting, but people don't understand the bottom line is that parenting is a very difficult job. It's difficult to be certainly a child growing up in this day and age, but it's also the pressure of parents to deal with their children's particular issues, especially higher anxiety, higher depression, higher PTSD. All of those things are now impacting parents, and they're talking about it.
There was another astounding number in this warning. Parents of kids with special needs report having fair to poor mental health. It's double that of parents of kids without special needs.
Yeah, and what we're seeing is certainly special needs have been around forever, but what we're finding is that we're able to diagnose much earlier, which is great because we're able to do early intervention programs. But because we are diagnosing earlier, parents are much more aware of what it is that they need to do. But that can also bring a lot of pressure onto the parents to make sure that they're able to get these services. One of the things Dr. Murthy talks about is the importance of connecting with other parents, almost as a peer group, a support group, to be able to provide for our children, whether they're on the spectrum or neurodiverse or may be having other challenges.
Given the challenges that you just pointed out that parents face, what can they do to improve their health?
Well, one of the most important things is getting out of this isolation that they're in. Dr. Murthy talked about that 65% of parents and 77% of single parents report feeling lonely compared to 55% of non-parents. So he talked about this earlier, this issue of isolation and loneliness. So it's really important for parents to reach out, to be able to get support from other parents, to be able to talk to other parents and be able to share not just their concerns, but what some of the empowerment strategies that may be helpful in working with their children and helping their own mental health.
I guess I'm curious, too, what is it about parenting today that makes it so dangerously stressful?
Well, we have to look at the fact that social media is very much of an issue for children and for parents. As we know, the rates of mental illness have increased around those particular issues, so they have to deal with that. Climate change is a concern for parents. They want to know what kind of world their children are growing up in. And then, of course, issues around finances and so on, being able to provide for their children, hoping to have universal health care, hoping to have paid time off so that they can address the needs of their children. All of those things now have become very germane and very important issues for parents. So it is much more stressful than I believe than it's ever been. But that's why it is important to have this support group around one another.
Yeah, leading to this stunning warning from the Surgeon General. Dr. Jeff Gardere, thanks for joining us this morning.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.